from the medical angle, there have been quite a lot of researches on the homosexual lifestyle. And as Mrs. Awago rightly told us, we should respect them, the people or individuals in this state, with a lot of compassion and sensitivity. But we have to call a spade a spade. There are some health risks associated with such lifestyles. So it's not just a moral issue, because some would tell you, so if I'm an atheist, if I don't believe in God, what do you expect me to do? It's not a question of that God said or God didn't say, or my pastor or my imam said. It's a question that is imbued, it's nature. And medical science, immunological science have proven some of these facts. I'll begin with one of the commonest health risks we find in the homosexual community is anal cancer. There are different kinds of cancers, but this particular one seems to be very prevalent in the community. Why? Because there's a universal finding among homosexuals. They tend to have human papilloma virus, which is a very important virus because of the influence it could have later on. There mightn't be any symptoms in the patient, but at the long run, what you get is an anal cancer. This anal cancer, when it spreads, can be fatal. Now, if a homosexual man happens to be bisexual and does have sex with a woman, this human papilloma virus gets deposited in the woman. And later on, years down the line, without symptoms in some cases, the woman ends up with cervical cancer. So we're talking about risk not just for the homosexual community, but that can be transmitted to other people in the population. And it's just one cancer. Now the explanation, the immunological explanation is that there are certain immune substances that are found in seminal fluid that naturally finds a response in the female body. Now, when seminal fluid with semen is deposited outside such bodies that are not female bodies, what we get is an immunological reaction. There is a kind of fusion with other somatic bodies, and this later on transforms into malignancies. I think it's a huge price to pay. This is immunological science. This is medical science I'm talking about right now. It could lead to consequences like liver cirrhosis, liver failure, liver cancer in the long term. And these are not things that you joke with. And of course, we've heard several times about sexually transmitted diseases. Most of us, I remember when I was in medical school, when the issue of HIV was just coming out, and the first thing we heard, this was usually associated with homosexuality, and the situation hasn't changed. There's a greater risk of transmission of HIV in homosexual communities, about the threat of sanctions from the United States and Canada and European Union. It's a joke that we're being threatened as a nation to remove the AIDS we're getting for HIV/AIDS in particular. There's an agenda behind this, and we give thanks to God and we give thanks to our leaders for having taken such a bold step, because we are very sure that they have been under a lot of pressure. And we have other sexually transmitted diseases like gonorrhea, and sometimes you might think that all the time that gonorrhea shows with some symptoms. There are some times that in some patients there are no symptoms. And as I said earlier on, if a homosexual man who is bisexual now has sex with a female, there's also this danger of passing on the same sexually transmitted disease like this gonorrhea or syphilis. And this will later on cause infertility in the woman. It's not a surprise that we have high rising cases of infertility in our medical profession. And then there's something called the gay bowel syndrome. There's inflammation of the rectum, of the colons, of the intestines, and in the long run, there's a debilitating illness that could lead to death. Apart from this, there are other health risks that are also common amongst this group of individuals. You have alcohol abuse. Usually there's some alcoholism associated with it. There's violence also amongst them. And incidents of psychiatric and psychological problems are raised by 37%. We have depression, risk of suicide, and reduced lifespan. These are all studies that have been carried out in the Western world. So really, I can't see much gain in beginning to think or join in this way of thinking. And medically, what we had, some people will tell you that they are born that way, that some have claimed that there are some genes that make it impossible for such people. I'm sorry to say, up to date, there is no such genes. There is no such genes that make somebody to become a homosexual. What you have, yes, there is a possibility of having a same-sex attraction, but that's a disorder. In fact, it's called SSAD, same-sex attraction disorder, SAD for short. Now, as it's a disorder, there is a therapy. So, like any disorder, when we have patients, for example, that are alcoholics, what do we do with them? We treat them. We help them to come out of it. So we have patients, as we have heard, up till the 70s, homosexuality was in medical textbooks under psychiatry. With the political correctness that is going on, it's been pulled out of medical textbooks. And such individuals are not being helped. What is healthy for the